Walker Street Doctors Fee Structure Explained. When you book your hot doc appointment online, you'll get a notification that an estimate of our fee is around $95, and Medicare will then subsidise part of that fee to you in order to decrease your out-of-pocket costs. But mostly it's not that simple or straightforward. There's no way around it. The fee structure in Australian general practice is complex and it's confusing. It's confusing because GPs are obliged to bill the most appropriate item number for the service, of which there are literally hundreds of item numbers with long and complicated descriptors. We at Walker Street Doctors are committed to providing the highest quality of care for you while being aware of your out-of-pocket costs. And I'm going to do my best to clarify it for you in the next couple of minutes by way of an example. A young woman comes in for her cervical screening, which is now due. We check her blood pressure. She asks for a repeat prescription for her contraceptive pill that she's been on for many years. And we get everything done in under 20 minutes and she's on her way. Our fee for that service is $95 and Medicare will rebate her $41.20 for that consultation, which fits the criteria for a time-based general practice attendance item number 23. And this is the most likely item number to be billed in general practice. A week later, her results are back, indicating that her cervical screening is normal, but the STI screening that we did concurrently was positive, and she's asked to make a follow-up appointment to discuss the results. The most appropriate item number here is item 92734. The fee is $95 again, and the rebate is again $41.20. But at the same consultation, she also wanted me to take a look at a skin lesion that she was a little bit concerned about. So we went on to discuss alarm symptoms with respect to pigmented skin lesions, and that was an item 23, which was co-billed directly to Medicare on her behalf. The patient indicated then that she'd become concerned about her relationship during the recent consult and would like to have a mental health care plan completed so that she could start sessions with her psychologist again. We started the process because there's only a few minutes left of the consultation time and booked a follow-up consultation for the next week to finish the GP mental health care plan. A week later, we spent time finishing the mental health care plan, item 2713. The fee was $135 and the rebate around $95. And then she said then that she was concerned that she might be pregnant. She'd missed a few pills last month. So we did a urinary pregnancy test, item 73806, and it was positive. And then undertook non-directive pregnancy counselling. Remembering that Medicare requires us to bill the most appropriate item number, and that item was 4001. She decided that she'd like to proceed with the pregnancy, so we started routine antenatal care, that is item 16500. But then she admitted that she has a sneaky cigarette at lunchtime with her friends who are smokers and is concerned about the potential effect on the baby, so we undertook smoking cessation counselling, and that item number was 93600. As a result of the smoking, her underlying asthma was not well controlled. We performed spirometry to get a clearer picture, item 11506, adjusted her asthma medications and updated her asthma action plan appropriately. And now that she was feeling more comfortable, she admitted that she did use some cocaine at a friend's wedding recently before she knew she was pregnant. So in addition to referring her to the obstetrician, we also referred her to the clinical pharmacologist to discuss that and put together a plan for her with SMART goals using the trigger of pregnancy as a motivator to improve her general physical and mental health, items 721 and 723. You can see the issue. We're obliged to co-bill multiple item numbers, which are the most appropriate to the clinical service. And you can also see how the costs can suddenly blow out when we provide really comprehensive care for our patients. In this third consultation, we've privately billed the patient only $135 for the first item number 2715, which was the reason for the visit. And her out-of-pocket costs for that item number were around $40. But for the remaining item numbers during that encounter, 73806, 4001, 16500, 93600, 11506, 721 and 723, we accepted the Medicare rebate for the service on her behalf, and that kept the costs down for her significantly. The total out-of-pocket costs for her for the 3 consultations was only around $140, and I think you'll agree that that was pretty good value for money. Her partner also had out-of-pocket costs for his GP, specialists, allied health and radiology for the calendar year, and because they'd registered with Medicare as a family for the safety net, this last out-of-pocket fee of $40 pushed them over the threshold, thus making her obstetrician's visits significantly cheaper for the remainder of the year. Please do see our corresponding video explaining the Medicare Extended Safety Net for further information. I hope this explainer on fees, Medicare safety nets, co-billing, split billing, and so on has been very helpful.